This is Cassie. I'm a physical therapist for TS Therapy in Michigan, in Troy. So I am here today to talk to you about CME. I'm going to wait a few minutes and let people kind of join on and see how everybody's here, and then we'll get started. I hope for those of you who are watching today, I hope you're having a good Friday and a great weekend coming up, and I hope everyone's staying safe. So we'll wait a few more minutes. While we're waiting, I can give you guys a little bit a background on me. So like I said, my name is Cassie. I'm a physical therapist. I got my doctoral degree in physical therapy from Bellarmine University in Louisville, Kentucky in 2013. I started my career in 2014. I actually started in short-term rehab working with adults, but I've always known I wanted to work with kids and was just waiting for an opportunity. So started working in pediatrics in 2016, and I've been with TS for the past 2 years, and I'm loving it. I'm super excited for CME. It's actually something I came across prior to being approached from TES for it. Just kind of looking for different ways that I could continue my education and get certified in techniques for pediatrics. And I was super excited when TES also brought it up as a treatment technique that we were looking into, and became really passionate about being one of the clinicians to get trained. And so I was lucky that myself and one of our OTs from the Michigan location, Amy Crowder, was also able to come with me. So we both got level 1 certified last year in CME. So it's exciting. We're excited to bring the program here to Michigan and just get it all started for you. So I'm going to go ahead and talk about kind of the format of what we're doing. If you haven't seen one of our lives before, I am just going to go through some questions that have been posed on about CME, and then if you have any questions, feel free to post them on here or to reach out to us, and we will get them answered for you. If not tonight, then as soon as possible. I want to keep this somewhat brief so everyone can see it. So if your question doesn't get answered, I promise we will get an answer for you. All right, so it looks like we got a few people on, so I will get started. The first question we have is, what is CME? Which is a great question, obviously, to start with. So CME stands for Cuevas Medek exercises. They were developed by Ramon Cuevas starting in the 1970s, and he is just continuing to develop to this day. He still treats, he still teaches, and he's always coming up with new techniques within these exercises. Medek is actually translated to meaning a dynamic method of motor stimulation. And so with that, we're looking at this as a treatment approach for a method of exercises that will develop the responses from motor delayed children. So we're provoking the automatic postural responses for motor delayed children. So these exercises were developed with the theory that the more distal support that's applied by the therapist over a child's body segments, the stronger the functional anti-gravity reactions are provoked. Meaning, the more distally, or the more further away from the center of the body that we're applying support, then exposing them more to gravity, which is going to provoke these automatic responses in children and provoke those motor developmental patterns that we're looking for. So the theory is actually something that is common for physical therapists to think about. The further away from the center of the body, the more that the child is having to do. But the technique and the approach of where we give that support is kind of different from what typical physical therapy sessions would look like. So it's kind of its own intuitive program, and it comes with its own assessment and own set of exercises. So it's very all-encompassing within itself in this program. So who could benefit from CME? So CME is designed specifically for children delayed in motor development, typically because of a neuromuscular limitation. So this can include a multitude of diagnoses, or even kids who don't have diagnoses, Some diagnoses that I know that we have seen or that clinicians have seen who work with CME include CP, Down syndrome, Rett syndrome, just genetic chromosomal abnormalities, Pitt-Hopkins, lots of different diseases and diagnoses, and all sorts of different neuromotor delays that can be addressed with CME. When we're speaking about those delays, some of the things that we're looking at are things like pushing up when they're on their tummy, being able to control their sitting or transition in and out of sitting, rolling, crawling, standing, walking, all those big gross motor developmental patterns that were typical milestones for children are ways that we can look at in CME and things that we can help promote. So with that, children should be evaluated to determine if CME is appropriate. So the CME is appropriate for some children. There are some children that the technique is just not going to provide that progress. So it's definitely important that if you think your child might benefit, to reach out to us. We can answer some questions over the phone, and then we can always provide an assessment and let you know if CME is the right fit for you. And we're always reassessing too with each session to make sure that they're continuing to progress with their goals and make sure that CME is always the right answer, because we do want to make sure that you are getting the proper care that you need and that your child is looking for. So our next question is, how many sessions does a kid need and how long do they last? So this is a very interesting question, because just like any therapy session or any therapy that your child may need, it's kind of variant depending on each child. So some children are going to need longer total sessions to make the progress towards what they are looking for, depending on what your goals are, or sometimes they'll meet those goals and then we add on to the next goals to keep that motor development going. Typically, we're looking at some different intensity models. Some kids will do more of a typical therapy program, which is 1 to 3 times a week. Or you can do more of an intensive program, which is daily, looking at usually like a 1 to 3 week stint of time, and then maybe we reassess, take a break, come back and do it again as we're progressing those next goals. So sessions usually last about 45 minutes to an hour. So it all is variant depending on your child and what they're tolerating, how they're progressing their goals for how long each session lasts, and then how many sessions in total that will do. What is your most rewarding experience with a patient is our next question. The great thing with CME is every day is super rewarding. Kids are learning new skills every day. Exercises that were hard for them the day before, the session before, are easy for them the next time, because we're trying to build those automatic responses. So it's just amazing some of the results that can be seen with CME. As a physical therapist, I really, really love when we can get kids walking that have not been able to walk before. I feel like that's a huge step and milestone for kids, and that parents get super excited about, and we as therapists get super excited about. But every milestone, everything that we hit is always rewarding and exciting. And like I said, this technique offers some sort of goal achievement almost every time. So we're, doing something different that was hard last time that they're able to do much easier each time. So it's kind of a huge, just rewarding experience each day, and each new exciting thing that we get to do, and that progress that gets to be made. My next question on here is, what type of motor problems would be treated with CME? So I kind of touched on this already a little bit with which children is this appropriate for. So we're looking at neuromotor delays. So things usually that we're thinking are like our big gross motor milestones. So head control, being able to pull their head up when they're on their tummy, push with their arms up on their tummy, sitting, head control and trunk control while we're sitting, transitioning in and out of sitting or in and out of standing, being able to do mobility skills such as rolling, crawling, walking, these are the types of things that we not only assess for, but then we also make those goals for to progress with these exercises. Obviously, this is not an all-inclusive list. There is definitely much more that we are looking at and that we can progress with as far as goals, but really we're looking at these neuromotor delays, things that are motor milestones that we are able to achieve with just using those automatic responses and being able to make all those milestones achievable for you. My next question on here is, how is CME part of physical therapy? So when I talked about what CME is, I was talking about how it is a treatment approach. So it is a treatment approach that PTs can use and they can get certified in. So there are multiple levels of certification, and with each level you're just increasing your knowledge base of exercises and approaches that can be used for your CME sessions. You're learning, like I said, Ramon is constantly making new exercises and new skills just based on each new individual that he treats and new ideas that come across. So it's really exciting that something new for each day and for each level that we get certified in. So physical therapy, obviously we can do sessions with CME. As I mentioned, we also have an occupational therapist who is certified in CME. So she as well is able to incorporate this into our program. So CME has a specific assessment, as I said, and specific exercises that are developed to follow this philosophy for techniques for the most optimal results. So when we do CME, it's more typically that we do CME sessions that are full CME. We're using just that treatment approach. I do have some kids that I look at that I'm doing traditional therapy with, that I might kind of try some CME techniques with them, see if it's something that maybe we also make that a program for them as well. But for the most part, it's kind of its own treatment sessions, its own programming that we work on. The next question is, what happens during CME? So during your first session, we go through that assessment. So as I said, there's a specific assessment in which we're placing the child in positions that gravity is resistant, and then we're assessing those neuromotor responses and how their brain and their body connect and what they do when they're in these positions. After we do that, we're able to score, see what's appropriate as far as if CME is appropriate, and then what goals and what exercises we can use. For the following sessions, it is repetitions of exercises. Usually we do it 3 to 5 times for each exercise, and they're following the same principles. As we put the gravity resistant position on the child, we give them distal support, and then we might be guiding movements, and we're allowing that brain to cause automatic responses so that the child is learning those neuromotor outputs and they're learning those developmental milestones with their own brain and body doing all the work. So most of our assessment tools most of our assessment of motor functions, each of the different categories that we're looking at in our assessment have multiple exercises that provoke the motor development. So each session may have similar or different exercises that we're seeing. So we may repeat some of the exercises in consecutive sessions, or we might add in new ones that work on those same goals, so that we're developing that motor response in different ways and helping that brain to learn in different ways, so that we can make that progress towards those goals. So each session is a little bit different, especially like I said, because we make progress quickly. So sometimes those exercises that we did last time, they already can do really well, so we might either do some of those or we might progress on to the next one. So each session looks a little bit different, but it's all kind of under those same principles and the same idea that we're going to be doing repetitions of those exercises to get that brain to keep responding in the same way and make that an automatic response for them to learn that motor pattern. My next question is CME only for children? So this is a good question. I do know that it started in development for children, and I do know that Ramon has worked with older individuals than many of the clinicians that are certified. Still within, I believe, the children range as far as ages. But I will pose that question to him to find out exactly how old he has treated. But the idea that these automatic responses that we're searching for is something we have throughout our lifetime. So as adults, we also have these responses. One thing that I think about is if you're starting to tip over or you lean over when you're sitting, your head automatically tries to pull yourself back up unless you're thinking about it and let your head go. You're not just going to let yourself fall. You don't just free fall normally. So you have these automatic protective responses in your body. Even just the idea of when we're standing up, you're not thinking about all the muscles you're using to keep your balance, you just do it. So those ideas that continues throughout your lifetime is there. However, it's hard to provoke those responses sometimes with adults if it's a diagnosis that has been present since birth or since childhood, just because over the ages or over time we've learned patterns that we kind of go around those automatic responses. We also, that these exercises are tailored towards those developmental skills that are typical and age appropriate for children. Not saying that there are not adults working on these same developmental goals, but those are typical for children as far as what those developmental milestones are for their age range. I think one of the biggest reasons why it would be hard to transfer CME theory over for adults is just the handling and positioning techniques. So where we have to give support and position them in all those different gravity resistance positions, it's just hard, I think, and limited by the therapist's size and strength for placing an adult in those types of positions and to giving that type of support appropriately and safely. So I personally, for where I'm at and certified, I would see mostly just children, but I will definitely ask Ramon and find out if how old he has worked with and if any adults have actually participated in CME. So the last question I have on here, and then I'll look and see if we have any questions posed on this live, is there any equipment used with CME? And the answer is yes. There is specifically designed equipment. It's very simple in appearance, but it has all these multifunctional uses to provide probably countless configurations for all the varieties of exercises that are developed and that are continuing to be developed by Ramon. I know throughout the years that even this equipment has had some changes made to it to add these variations, but Ramon has been very genius about how he's created this equipment and making all of this possible with just a few pieces of equipment. So at our clinic or on our CME website, if you want to go on and watch our video or see our pictures, you can see some of the equipment that we use. So it's wooden boxes or steps that can be used in a multitude of different ways. There are different heights. Some of them have notches in them that are designed for configurations with the wooden bar or board that can lay flat, almost kind of like a balance beam. And there's also like a flat platform. So just a lot of different small pieces that can come together in a lot of different ways and make it really simple to work on these exercises. But it's just awesome how such simple equipment can make such a big difference. Because like I said, most of what our exercises are doing is making the brain and the body do all the work. So we don't need all this extra equipment. We don't need all this extra support to them. It's just simple things that they might encounter in day-to-day activities for walking, balance, steps, all of that, and just using that nice and simply to get their body to be able to make those responses they would do in daily activities of encountering these things. You can also see that we use a table at times, just a mat table for working on things like sitting, kneeling, crawling, those things that might not necessarily be on the floor. And with walking and standing and balance, we just use a nice mat table for some of those exercises as well. Outside of that, there's really no equipment because they're all doing the work just themselves and how they're moving and how their brain and body is connecting. So let me make sure we have no questions on here. If you have any questions, please feel free to post them now, or you can post them later if you're not sure yet. Let me just make sure. I don't see any questions. All right. Any question? Oh, I have one. What is your favorite thing about CME? All right, so I think my favorite thing is, oh gosh, I don't know. How do I pick just one thing? I like that it is using an approach that is completely understandable to me. Like I said, the idea of this distal support is something we think about already as PTs. Traditionally, when I'm helping a child walk, and even as parents, you might know this, that you start by holding their hands, and their hands are up high, and then we bring them down lower, or we hold them at their upper arms, and then we bring them down to their arms, and then we give them one hand. So we're giving them less and less support, farther and farther away from their body. But I've never thought of the idea of moving down to the legs to give that distal support, which is one of the techniques in CME that you can definitely see in our video. And it's just, it's kind of a different way to approach it, but makes so much sense. With that, I also am super excited about how every day is different and every day they're making progress. Like, that's so rewarding as a physical therapist and as a CME clinician, that every time we're seeing kind of more progress. And I think it's just, just rewarding that they're making these goals. So kids often who've gone through traditional therapy and just haven't made that progress towards the goals that they're looking for, have made progress in CME. So those individuals, it just makes it so inspiring and so passionate for me to be able to start this program here in Michigan, because we've seen this progress with them. So hopefully that answered your question. Any other questions for me? And like I said, you are welcome to post them on this video, ask them at our on our Facebook, or even contact us at TS at our TS website. Let me make sure I have no other questions on here. So you can find us at tesidea.com, so tesidea.com, and that will have our Michigan location, so you can reach out to us that way if you want, or reach out to our other locations, but our Michigan location has our CME program. We also have a CME page as well, where you can look at that video I was talking about. I don't have any other questions on here either. So that is it for me today. So like I said, if you have any questions, please feel free to reach out to us. Otherwise, you guys have a great Friday. Enjoy your weekend. And I hope to hear from you soon if you have any questions or think that your child may be appropriate for CME. Thank you.